Had so much fun hanging out outside with you folks for the last video, I thought I would try it again here. So in this video, I want to start talking about some of the approaches that psychologists use to help people. And the first I want to mention, honestly, is less used by psychologists, more used by psychiatrists who are medical doctors. They use the biomedical approaches to assist their patients. So one option is to use drug therapy. They call it psychopharmacotherapy. This is where medications are prescribed for people with specific psychological disorders, like depression or schizophrenia or bipolar disorder. It's challenging, though, to find the right medication, the right frequency, the right dosage level to be able to assist people. Plus, some of them could have bad side effects, so they could prove to be addictive. So I'm always a little bit nervous about that approach. But again, that's mainly psychiatrists. Likewise, there's something called ECT, shock therapy, electroconvulsive therapy, where they give a series of electrical shocks to a patient. This is done willingly after the person has been sedated. And these days, they mainly just use it for people with severe depression who are suicidal. If nothing else seems to work, they might try this. The side effects are minimal, sometimes short-term memory loss, but some people feel it's kind of barbaric and medications are preferred more these days. Another option is to do psychosurgery, surgery on the brain. Like you might remove a tumor, or in some cases they've removed an entire hemisphere of the person's brain, especially for young people who have severe epileptic seizures that are frequent and nothing else seems to work. They used to do something called lobotomies, where they sever the nerves connecting the frontal lobes to the rest of the brain. They don't do that much these days. Beyond that, though, let's get into the psychological approaches. So the first one I wanted to address is called psychoanalysis, or the psychodynamic approach used by Freud. And keep in mind, their focus there is that a lot of your problems have been caused by unconscious issues, many of which started in your childhood. So they want you to have an emotional release called a catharsis. They encourage people to say anything that comes to mind. Just go with the flow of your thoughts. They call that free association. If you've ever done any stream of consciousness writing, it's kind of like that. And they just want you to go where your thoughts take you. And then the therapist is going to help you understand kind of maybe how things are connected within your own mind, perhaps. They also encourage people to talk about their dreams, and then they will analyze them or interpret them. They understand that sometimes people will exhibit resistance, or they don't want to talk about some of the key issues. But Freud believed that in order to get better, you really have to talk about some of these things that are really upsetting and emotional for you. And then they also understand that sometimes transference may occur, where you may take out your true feelings like anger on the therapist, or you may start feeling like you're falling in love with your therapist. In its original form, psychoanalysis, it was a long process over years and very intense. They don't really do that these days. Instead, psychoanalysis or psychoanalytic therapy has been replaced by more psychodynamic therapy. It's still based on Freudian principles, still a lot of focus on the unconscious mind, but they actually do sit face-to-face with people, whereas Freud used to have people lay down on a couch and not make eye contact so they wouldn't feel self-conscious. Psychodynamic therapy is shorter, and there's a bit more direction given to people, whereas with psychoanalysis, it was a lot of, that sounds interesting, tell me more about that. And they'll try to interpret things. With psychodynamic therapy these days, they give a bit more advice. Hope that helps. We'll talk about the other 3 major types of therapy in the next video. See you then.